Hi, my name is Bree. I'm going to do the NG tube insertion and removal. Prior to entering the patient's room, I'm going to review the patient's chart, making sure that they don't have, checking for history of nasal polyps, nosebleeds, anticoagulant therapy, chronic sinus infections, oral or facial surgeries, and aspiration. After that is done, we will enter the room. Knock, knock, knock. Hi, my name is Bree. I'm going to be your nurse today. I have verified the orders for a patient to get an NG tube insertion due to bowel obstruction. I'm going to do 2 patient identifiers, name and date of birth. Patient has done that and is concurrent with its wristband. Do you have any allergies? Patient says no. I'm going to provide privacy. I'm then going to perform hand hygiene. We're going to educate the patient on why they're getting an NG tube, which is for a bowel obstruction to help resolve the bowel obstruction. We're going to ask if they have any questions. We're going to tell the patient about communication methods during the process because we're not supposed to talk. So we're going to tell the patient, if you can just tap me, do a thumbs up, do a thumbs down. If you want me to stop, you can tap me or do the thumbs down. You may experience some gagging or discomfort during this process. Do I have your consent? Yes. Okay, thank you. So I'm going to then ask the patient, do you have any goals of this? Obviously, it's to resolve its bowel obstruction. Since I have consent, I'm going to then ask the patient, have you had any nausea or vomiting? No. And are you in any pain? No. Okay, so the patient is not in any pain. Next, I'm going to perform hand hygiene. I'm going to inspect the nasal passages for any nasal polyps, obstructions, septal defects, or mucosal irritation, which I see none. I'm going to then have the patient do the test for patency, holding one side of the nares and the other. When the patient did that, it seems as if the right side is better for the insertion of the NG tube. I'm going to ask the patient if they've had any trauma to their nose, any surgeries, or any nosebleeds. The patient denied all of those. Next, I'm going to do a focus assessment. I'm going to auscultate the lungs and the bowels. Now auscultating the bowel sounds. Since the patient does have a bowel obstruction, bowel sounds were not present. I'm going to palpate the bowel sound or the abdomen now. Abdomen is distended due to, of course, he has a bowel obstruction again. Now we're going to raise the patient into a 90-degree angle for the insertion of the NG tube. I'm going to perform hand hygiene. I'm going to prepare my tape, making sure they're 3 inches. I'm going to do 3 pieces on a clean, sanitized surface, making 1 split halfway down the middle. Self-identifiable break. I am going to check patient's gag reflex. Gag reflex is intact. I am then going to get the materials to measure how far we need to insert, going from the nose down to the ear to the xiphoid process, which is 55, and then adding 10, so we're going to go to 65. At this time, I'm going to perform hand hygiene, apply gloves, applying gloves, and we're going to, before starting the process, we're going to put a pulse ox on to measure the patient's O2 sats during this time to make sure that they do not drop. I am then going to lubricate the tip of the NG tube for at least 4 inches, and then we will start the process. I'm gonna have the patient put their chin to their chest, and every time you swallow or every time I insert, I'm gonna have you swallow. This will not go in all the way, just to let you know. So we're gonna go in and go back towards the ear. We're gonna go all the way down till there's about 10 left. So we had 55, so we're gonna go to 65. At this time, I'm going to use my tape, the split tape, to the bridge of the nose. And it's not gonna stay to this patient, it's just not adhering to him, but I am taping it. I'm going to then apply tape to the bridge of the nose to keep it attached. At this time, the connector is attached, so I'm going to place this right here. I'm going to auscultate the lungs to make sure I'm in the abdomen and not the lungs. Self-identifiable break number 2 for this. I never let go of the NG tube prior to taping until it was taped. I'm going to use a syringe to pull back gastric content. I'm going to pull back gastric content. I'm going to test pH, and then I'm going to replace the gastric content into the patient. I'm then going to tape the tubing to the patient's gown to prevent them from pulling. I'm going to remove my gloves, perform hand hygiene. I'm going to lower I'm going to remove the pull socks. I'm going to lower the bed to the lowest position, put the side rails up, lock the wheels, put the collar in position, make sure the patient is comfortable at all times, make sure the patient does not need anything, and then I'm going to exit. I am now going to do the removal of the NG tube. I'm going to knock on the door. Hello, my name is Bree. I'm here to do the removal of your NG tube due to the resolve of your bowel obstruction. Can you tell me your name and date of birth? It is concurrent with their wristband. Do you have any allergies? Patient denies any allergies. I'm going to provide privacy, and then I'm going to educate the patient again on removal. Removing it because your bowel obstruction has resolved. Do you have any questions? You may have discomfort and gagging due to the removal of the NG tube. If it gets to the point where it's just unbearable, please do not communicate because it could disrupt it. Just tap my hand or put your thumb up or just do some type of movement with your hands. I'm then going to ask if the patient has any goals due to the outcome and get verbal consent. At this time, I'm going to perform hand hygiene. I'm going to apply gloves. I'm going to then get my clean syringe. We're going to insert 20. This was connected. I'm going to insert 20 of air into the NG tube. I'm going to remove the tape from the gown and the tape from the nose, not pulling out the tape just yet. Telling the patient to hold their breath when I'm pulling it out. I'm pulling the NG tube out, making sure the NG tube is intact. Self-identifiable break number 1 for the removal. I am going to kink clamp in before pulling out the NG tube. The NG tube is intact. I'm going to discard of all of my items. Perform hand hygiene. Make sure the patient is comfortable. Placing the bed in the lowest position, wheels are locked, side rails are up, call light is in position. Ask if the patient needs anything. If they don't, then I'm going to leave.